and today we want to talk about IV cannula. These are usually used in medication intravenously when giving intravenous medications and IV fluids. So we have like 7 different types of cannula based on color coding and gauge, that is size. And number 1 type of cannula that we have is the gauge 14, which is usually orange in color, and it is the largest one. This one is used in trauma and during rapid transfusions and other intended procedure. So patient with multiple trauma and they will want to maybe have theater, they will use that, and usually it gives up to 240 milliliter per minute infusion. And the other one is the gauge 16, which is gray in color, and it is best used when we are having explorative surgeries and with patient with trauma. It gives up to 180 milliliter per minute. That's approximately 1 liter in 6 minutes when it is when the giving set is fully open, or the syringe pump or the infusion pump. We have gauge 18, which is best for normal blood transfusion, and it is usually gives up to 90 mils per minute. That's approximately 1 liter in just 11 minutes. It's best for blood transfusion. And then we have gauge 20, which is pink in color, and it's best for admitted patients for medication and intravenous fluid maintenance, and also some antibiotics like IV antibiotics. And usually it gives up to 60 mils per minute, and this is just about 1 liter in 17 minutes. And then we have the other one here is usually gauge 22, which is blue in color, but this one is usually mostly for children ages 10 to 14, and the best for slow infusions. And as you know, children have small veins, so it works best. Also, we can use it during vein puncture among patients with the difficult veins when using a syringe of a retainer needle. It usually give up to 1 liter in just 28 minutes. The other one is gauge 24, which is yellow in color, usually used for pediatrics. It gives up to 1 ml in 50 minutes, and that is approximately 20 ml in 1 minute. And this is best for pediatrics and adults with fragile veins or elderly population. We have gauge 26, which is violet in color and best for neonates, usually 13 ml per minute infusion. That is approximately 1 liter in just 1 hour 17 minutes. Always remember that the best cannulas for adult ranges from gauge 20 to gauge 14, and then from gauge 24 for adults. The following factors are considered when choosing appropriate cannula: that is condition of the patient with multiple disease conditions like anemia, malaria, or dehydration. We have to choose large cannulas. And then the procedure intended. When inserting cannula, you have to know your patient whether they are going for explorative surgeries or orthopedic surgery. So you need large cannulas like gauge 14 and the gauge 16. Also, the nature of the client or patient vein. So patients and the elderly population are very fragile veins, so you are twisting veins, so it's better to use a cannula with a small gauge, that is gauge 24 and gauge 22. And then gender, patient's age. For children, you have to use from gauge 22 to gauge 26, and then for adults from gauge 20 to gauge 14. Gender also, that is female, usually have difficult vein compared to male. Even those who are obese have difficult vein compared to those who have lean muscles, so you have to choose the appropriate cannula type. And the last 2 is the type of fluid or infusion or medication you want to give. So there are some heavy medication like amphotericin B, you have to use large cannula from gauge 20 to gauge 14. And also for the normal infusion or maintenance fluid, you have to use gauge 20. Also experience matters here. If you're not experienced, trust me, it's better to go for small gauge cannula because it will work better and it will avoid unnecessary vein puncture. Thank you for watching. Please stay tuned for other videos. Remember, cannulation is a sterile procedure.